change in lockdown levels. What's likely to happen between now and what needs to happen between now and September, when experts say our infections could peak? Mia Malan is the editor of the Bhekisisa Centre for Health Journalism. She joins us now for more on this. Mia, good evening to you. Firstly, what's expected to happen between now and September when our COVID-19 is expected to peak?
So because our lockdown levels have been relaxed and there's now more movement, we're likely to see a gradual increase in the number of COVID cases over the next 8 to 10 weeks. And projections are that round about July, there is likely to be an inflection in cases or a rapid increase that will likely peak towards the end of August or early September. And if we do see a sharp increase in cases in July, that will coincide with a period where we start to see hospitals and ICU units filling up. When that inflection happens, we're likely to see lockdown levels being increased because the government's approach is based is a risk-adjusted one, which means it gets adjusted based on two things: the rate of new cases and the capacity of health services to cope with those cases. So we will almost certainly see outbreaks everywhere, at workplaces, at shopping malls, at schools. Everywhere where there's movement, there's a risk of infection. And that risk can be mitigated, but it can't be eliminated. We're just going to have to learn to live with the threat of this virus.
All right, Mira, big conversations around opening schools. This is a wise idea, given what you've painted?
Well, there's conflicting evidence on the benefits of closing down schools, but the reopening of schools almost certainly means that there will at least be some outbreaks at schools. The danger with that is that while children generally get mild or almost no COVID-19 symptoms, many of them live in households with 3 family generations. So there would be grandparents or even parents who are older than 60 who are very vulnerable to serious COVID-19 disease. And children would therefore need to learn to do social distancing at home, and that means no hugging, no kissing, and constant hand washing. And as you may know, many private schools in South Africa opened on Tuesday, and they were allowed to open because they chose the online route to conduct their classes online. But as we know, that unfortunately is not the reality of most children in South Africa. So the school situation highlights again the extreme inequality in the country, because for poorer kids, the choice essentially is no education or go to school and risk getting infected.
And people who are working from home, as I imagine you speaking to us from, Mia, will they be able to return to their offices by the end of the year, do you think? Could it really take that long?
Well, I don't know, but I could make an educated guess. It's possible that we could see a lowering of lockdown levels in the near future, so that we get the economy going. But when we get to July, when there's likely to be a sharp increase in COVID cases, the lockdown levels will possibly go up again. And because if the current projections are accurate, cases will then continue to increase until September, when we have a peak, and we will have to mitigate that risk of infection during that time with restrictions on movement, which essentially means higher lockdown levels. So in many cases, we're looking at many more months of working from home. Even if there are short periods in between when you can return to the office, you may have to go back and work from home again. So some scientists like Salim Abdul Karim that you've just spoken to predict that many companies will have long-term policies where they will have 20 to 30% of their staff working from home permanently, because that would mean that the staff who can only work from the office will be in a better position to practice social distancing because there will be more space and fewer people.
Mia Malan, as always, thanks so much from the Bhekisisa Centre for Health Journalism.